Hello, this is Dr. Muhammad Athaullah, a senior consultant physician from Care Hospital, Malakpet. Today, I would like to tell you something about obesity. Obesity is assuming have very, very important proportions in our community. Obesity is nothing but we measure obesity by what we call it as body mass index. Anybody who has a body mass index, that is weight by height into square centimeter square, anybody above the body mass index of 23 is labeled as obesity. That's one. Number two is we also quantify obesity by measuring the waist circumference. So waist circumference can be different among men and women. As far as India and Southeast Asia is concerned, anybody who has in males who have a waist circumference of more than 90 is considered as obese, and in women, any woman who has a waist circumference of more than 80 is considered as obese. And if you look at the Western data, the definition of obesity where in the Western data is anybody a body mass index above 25 is called as obese. But in India, obesity is a body mass index of more than 23 is called obese. And why obesity is important is because it has so many problems. Like it can lead to diabetes. People may have dyslipidemia, or LDL cholesterol can be very high. They can also have fatty liver disease. And more importantly, these people are more prone for cardiovascular disease in the form of coronary artery disease, which is a very, very important problem in our society and cause of a high morbidity and mortality. And another important thing is the amount of fat which is present in visceral areas, that is abdomen, is very high in Indian subsets of patients. If you compare a person from West with a similar body mass index of a person from India, that is say both of them have a body mass index of 25 or 24, the amount of fat content in the abdomen in Indian subsets of patients is very high. And this fat is supposed to be metabolically very active and is a dangerous fat. That is why it is a white fat which is more dangerous. And because of this dangerous fat, we are more prone for the complications like cardiovascular disease. Another important complication of obesity can be osteoarthritis. We are seeing lots and lots of patients with osteoarthritis these days, and there is no definitive treatment for osteoarthritis, and only treatment which is available today is knee transplant, if the knee joint replacement, if the patient can afford. That's one. Another important feature which we are seeing these days is obstructive sleep apnea. Obstructive sleep apnea is nothing but a situation where an obese person comes to us with a history of daytime sleepiness and nighttime snoring. So this has become extremely common in our society. At least in my practice, I am seeing at least half a dozen cases per week. So every day, almost one case per day I am seeing of obstructive sleep apnea, because obstructive sleep apnea is an offshoot of obesity, and there is no medical treatment for this as of now. Only treatment available for obstructive sleep apnea is the patient should be on lifelong auto CPAP or BiPAP machine. So we have to reduce the weight by adopting healthy lifestyle, by going for a brisk walk, doing exercise, going to a gym, and eating foods with low calories where you can reduce your weights. There are some drugs available to reduce weight, but these drugs are extremely expensive. So my advice to all of you is to reduce your weight by lifestyle measures, in the form of exercise and dietary restrictions, and go to a brisk walk, go for a walk every day, and that's going to help you a long way in your health. So healthy eating in the form of fruits and vegetables. Half the food you consume should be in the form of fruits and vegetables. And among these fruits and vegetables, the fruits and vegetables which have high color, they have been found to be very, very good for the health, because these high colored fruits and vegetables, they contain antioxidants. And also a brisk walk at least half an hour per day. Even if you are unable to go to a gym, a brisk walk would reduce the weight and also reduce the cardiovascular complications. Thank you very much.